This is a training video for how to manually prone a ventilated patient. Please note that we will be using a Sally tube to assist healthcare providers to prevent any injuries. Be sure to tell the patient what to expect and that you will keep them as comfortable as possible during the procedure. Nurses should move the electrodes to the patient's back, remove stat locks for a Foley, remove anything that would create pressure under a patient when in a prone position. Tuck the arms and legs on the side you're turning the patients toward under the patient slightly. A respiratory therapist will be at the head of the bed monitoring the airway and lines. The patient will turn towards the vent. At a minimum, you should have 2 staff on each side of the patient. A full flat sheet under the patient, a full flat sheet on top of the patient, and place pillows over the chest and arms. Then place another flat sheet on top to hold in place. Roll up the top and bottom sheets together at the sides of the patient. The staff on the side the patient's turning away from will be rolled up. The staff on the side the patient's turning toward will roll the sheets under, making a burrito around the patient. Shift the patient to the edge of the bed, opposite of the side you're turning the patient toward.
1, 2, 3.
Turn the patient's head away from the direction of the turn. On a count of 3, use the sheets to roll the patient to the side.
1, 2, 3.
And then to a prone position. As you're doing so, adjust any lines, arms, or legs.
Okay. 1, 2, 3.
And once they're comfortable, consider placing the bed in Trendelenburg to raise the patient's head of their bed.